Welcome to our prenatal HIT workout. I'm Rebecca Gahan with Kick at 55 Fitness. Today, you will need a pair of lighter dumbbells, an elevated platform, and a couple of pillows. Remember, subscribe to our YouTube channel and click on the bell to receive all of our notifications. So, all you pregnant mamas out there, let's get started with the warm-up. We're gonna march in place. So today's workout is for those of you who are either trying to conceive, have already conceived, or slightly postpartum. This is definitely going to be lower impact, but we are going to have circuit training, which will give you a little bit of that HIT exercise that you so enjoy. Okay, next up we're going to mountain climbers. So if you are just newly pregnant, we can go into mountain climbers in a plank. But if you're in your second, third trimester and it feels more comfortable, you should go into an incline position. Bring your knees up to your chin. And we'll talk about later why it's important as you progress in your pregnancy to have an incline position for all plank exercises. All right, next, out, out, in. So we're gonna take our legs out and in. So we're trying not to do a lot of bouncing right here. We understand that whether you're in your first trimester and you're feeling a little woozy, or you've progressed quite a bit and your stomach's really large, jumping up and down might not be what you wanna do. Now, if you do feel like jumping up and down, instead of marching in place, you can do high knees. But I'm gonna take it down to a march. And as we go through this workout, we'll talk through the different trimesters and what you should and should not be doing. Okay, we're going to either incline mountain climbers or mountain climbers in a plank position. Driving those knees to your chin. 10 seconds. 5, 4, 3, 2, and 1. Out, out, and in. So let's talk through from the beginning stages of pregnancy what you can and cannot do. So the rule is that anything that you did prior to conceiving, you can do some form of that once you are pregnant. So if you were doing our HIT boot camps, doing more circuit training, HIT workouts is absolutely fine to do while you are pregnant, assuming that your doctor has not put you under any restrictions. All right, let's march in place. So for example, you just got a positive pregnancy test. Literally, you just saw that stick. You haven't even gotten into the doctor yet to confirm with the doctor whether you can work out. So what should you do? Well, really the rule is if you're not having any sort of symptoms like any bleeding and your doctor never told you that you were at high risk, you really can just proceed as normal. We'll talk about a couple of positions later on that you should avoid. But you also need to listen to your body. So what happens in the first trimester, let's get down for either incline mountain climbers or mountain climbers on the ground. In the first trimester, especially at the very beginning, your body is working overtime. Whew. And this is when you're the most tired. You need to listen to your body. You might have been doing 55, 60-minute workouts, and now just getting through 30 minutes is a chore. Give your body a break. That is what's most important in the first trimester. But the reality is, if you've been a runner, if you've been doing these HIT workouts, you've been lifting weights, as long as your doctor, and I keep saying that, your doctor says you're not under any restriction, you can just proceed with the same exercise routine. Okay, out, out, in. But again, maybe it's 6, 7 weeks, the morning sickness, which for me was all day sickness, comes on like a truck. And I'm gonna tell you something you wouldn't expect. You might not be able to exercise for a couple of weeks. Listen to your body. You need the rest. It's okay. You'll make up for that lost time later. Okay, break. I know, something we don't do often in our other workouts. Get some water, make sure you stay well hydrated. I also like to keep my dumbbells nearby so I don't have to bend over so much. We need to start to learn to squat down versus bending over. You don't want to throw out your back while you're pregnant. Okay, so you can put your water here. I'm actually gonna put mine down because I'm gonna be using this bench. So, one of the most important things that we need to do while we're pregnant, before we start with circuit one, is we just need to discuss engaging the core. So, about 2 fingers below your belly button, I want you to press against, contract your core, take your hips under. Okay, now I want you to arch your back, and then come to this neutral position, contract your core. This is where I want you to be, contracting your core as we do all these exercises. Whoa, we're gonna start with circuit one, squats. No weights, just to focus on contracting your core. So we're going down and up. If you wanna pick up some weights, that's fine. But right now, what's most important is I want you to focus on doing this lower body exercise and engaging your core simultaneously. This is more important than any core exercise where you're lying on the ground. And we will do some of those today. But I want you to focus on letting your hips relax, sitting down into this squat, and contracting your core. And exercise 2, we're gonna take our dumbbells. We have bicep curls. Again, still contracting your core. Bring your palms facing up. There we go. Everything is timed today. I don't want you to worry about your rep counts, how fast you're going. I want you to think about your form, your breathing, your stance. Shoulders back, chest out. We're gonna get through one set of circuit one, and then we'll start talking about trimester 2. Let's go 10 more seconds, and then we have push-ups. 5, 4, 3, 2, and 1. Again, if you are feeling like you should not be in a plank position on the ground, and we'll talk about why later, then you go into an incline position for these push-ups. And if that's bothering you, you can be on your knees doing those push-ups. I'm gonna go straight on the ground though. Although I have 3 children, I am not pregnant. I chuckle when I say that. All right, we're gonna do these push-ups, then we have alternating lateral lunges, and we'll start again. Remember, contract your core during these push-ups. 5, 4, 3, 2, and 1. Alternating lateral lunges. Again, we're gonna focus on taking our hips, tucking them under so you arch your back, then you bring your hips under, contract that core. We're gonna take our right leg out, bend at the knee, our left leg is straight, and then we go the other side. Alternating lateral lunges. If you want to hold some dumbbells here, you can. Letting those hips open up. Should feel really good in the pelvic region. Stepping out. We're gonna work a lot on the inner and outer thighs today. About 15 seconds remaining, then we'll go back to those squats. Just like we're supposed to, goodbye to the past. Letting go of the darkness. Okay, so we're gonna start again. If you need an extra break, you can pause me. We're gonna squat down and up. So let's talk about the second trimester. So the second trimester comes and you are feeling so much better. Usually sometime between 14 to 16 weeks, your morning sickness completely subsides. Now, what happens is you might have a slight rounding of the belly, but for the most part, a lot of people do not know, especially if it's your first, that you're with child. Which you kind of want everybody to know because you're like, they just think I have a belly now. So again, your exercise routine might be about the same and you're feeling a lot of energy at this point. So take advantage of it. It might be time to rev up your workouts a little. So let's go through kind of some myths and some facts as we go into bicep curls. Okay, remember, always remember that pelvic tilt, hips tucked under, contract that core. 1, can we do HIIT workouts like this, where we're taking our heart rate up and down while we're pregnant? So we addressed this in the warm-up, but I'm gonna address it again. If you did something similar pre-pregnancy, then you absolutely can do this while you're pregnant. And again, I always say, assuming your doctor gives you the go-ahead. 2, can you lift weights, or do you have to go super light with the weights? It's all a continuum. If you were lifting, let's say, 15 to 20 pound dumbbells prior to being pregnant, maybe initially you go 15, 20 pounds, and then as your belly enlarges and your center of gravity moves, you maybe take it down within a percentage of that weight. So maybe you go to 12s and 15s. But you don't all of a sudden have to go from lifting 15 and 20 pound weights to then 2, 3 pound weights because you're with child, as long as you did so prior to being pregnant. Let's go to push-ups. Remember, you can go on an incline if you feel like you can't go into that plank. So a lot of people think, well, I'm pregnant, so I should stop lifting weights, I should stop jumping around, and I should just do yoga. False. Yoga definitely should be a part of your routine, but lifting weights is very important. So let's talk about the myth. I'm at a greater risk of injury. Okay, let's stand up, alternating lateral lunges, because I'm working out. False. You're at a greater risk for injury if you don't work out. The majority of pregnant women injure themselves in non-workout related activities. And that's because they're not conditioning their body and strengthening it while pregnant. Right now, this is a very controlled environment. You're watching your environment around you, you're focused on having a core contracted, your posture is good, at least I hope so. But now what happens when you're in the grocery store and you turn and all of a sudden you throw out your back? Or you're in your new baby's room painting some trim and then your shoulder tweaks. Or you turn suddenly as you're putting something up on a shelf and you hurt your knee. Again, all things that can hopefully be avoided by doing the proper training in the gym and keeping your structure nice and strong. We can't afford to not work out while we're pregnant. And I say we collectively, but my days are over. Okay, we're starting again, third and final set of squats. Getting down and up, and again, if you're now feeling this, and you wanna grab a heavier weight, weights at all, but right now I'm just focusing on our form. Down and up, you can go a little faster if you want. Sinking nice and low. This should feel great. More seconds, then we go for that final set of bicep curls. Now, true or false? You can't lift weights overhead as of 25 weeks. False. The whole point of not lifting weights overhead is because your center of gravity changes and you put yourself at a greater risk of injury when you elevate weights overhead. Some women never experience this. Let's grab our dumbbells for bicep curls and continue to lift weights overhead the entire pregnancy. Some people, around mid to the end of the second trimester, start to feel like, oh, whoa, I'm lifting weights overhead and I'm feeling a tweak in my neck. When and if you feel that, that's when you stop lifting weights overhead and just stick with bicep curls, triceps, anything where the weights are not coming above your shoulders. Here we go. 8 seconds, then we go to push-ups. 5, 4, 3, 2, and 1. Remember, we can go in an incline push-up or down on the ground. In circuit 2, we'll talk about plank position, lying on your back, when and if, and what you should do. Five, 4, 3, 2, and 1. Alternating lateral lunges. So we're coming to the end of circuit 1. We'll get some water. Let's talk about one final myth. As a pregnant female, you cannot get your heart rate over 140 beats per minute. False. That used to be the standard back in the 1980s, 1990s. Today it's all about perceived rate of exertion. Can I still have a conversation, but I'm not feeling so out of breath that I can't talk? You should not go above a 7 out of 10. So again, you have a breathy conversation. That is where you should be. But 140 beats per minute, that heart rate, that's so different on so many different people. And honestly, that is just an old myth that has been dispelled. And circuit 1 is complete. Get some water. Towel off if you need it. Momentarily, we'll go to circuit 2. You will need a pillow, potentially. We'll talk about who needs it and why. So just catch your breath. We are gonna get started with stationary lunges. And again, I'm gonna start with no weights. And if you wanna start with weights, because it's something that you do all the time. All right, we're getting started with circuit 2. Hips tucked under, right leg in front, stationary right leg lunges. Down and up. If you're holding weights, they'll be at your side. But I'm more concerned with your form, engaging your core, laying that knee, come as far down as possible. In 10 more seconds, we're switching to the left leg in front. And switch, left leg in front, tuck those hips under. Here we go. Shoulders back, chest out. So let's talk about going on our backs because we're about to go there. At a certain point, as the baby gets bigger, and a lot of times this happens more quickly in women who are shorter because they have a shorter torso and the baby comes out. The baby potentially, when you're in a supine position lying on your back, can press down on your vena cava, which then can impede your breathing. That is why you want to elevate your head if when you lie flat on your back, you feel like you can't breathe. So we are gonna go down on our back. Now remember, as we go down, you squat and then kind of go on your side. So I have 2 pillows here. I'll show you what you need to do if you are gonna lie a little bit elevated. Okay, so we're gonna take our knees up to a 90 degree. We're pushing our back into the floor, contracting our core, and then bringing our heels to the floor, really feeling this core contracting. This is one of the best exercises you can do to prepare your core and your body for labor and delivery. A strong core will equal a great delivery. Now again, if you either don't need that much of an elevation, remove one pillow or remove both. But it's only when you feel like when you're on a flat back and you can't breathe because the baby is getting bigger and pressing into your vena cava, that's only when you need. You'll know when it's time to elevate your head. Now, as we stand up, we roll over on our side, okay? And then come up. Don't try and come up with your core. Even if you're early on in your pregnancy, I want you to start to really focus on getting up from the side. So next up, if you have 2 light weights, we're gonna go for overhead tricep extensions. If you have just 1 heavy weight, you can just hold both or 1 weight with both hands. I'm gonna do 2 dumbbells because I am using some lighter dumbbells today. Overhead tricep extension. So we've talked about when and if you can be on your back flat and when you need to elevate. Now let's talk about when you can be in a prone position flat and when do you need to go on an incline. Okay, let's put those dumbbells to the side. I'm gonna move my pillows out of the way. Always make sure that there's nothing in the way. You don't wanna trip. We're gonna go back to stationary lunges on the right leg. So, in a prone position like a push-up, a plank, a burpee, everything is pulling in the middle of your stomach. And as the baby gets bigger, if you feel this pulling when you're in a plank position, it's really only as you progress in the pregnancy. You can form a split in the muscle wall that will not be evident until postpartum, when the muscles try and grow back together and there's a separation there. So this is the rectus abdominal area. And again, if you feel a pulling, and you'll know when you feel that pulling in that plank position, then it's time to go to an incline. Some women never experience this, switch legs. Some women experience it maybe in the middle of the 2nd trimester. But if and when you feel it, you go to an incline. And if for some reason, postpartum, you feel like there's a split in this abdominal region, you need to go to your OBGYN, and then you can go to physical therapy. And what that's called, that condition, is when there's a split that's more than 2 centimeters, it's like you can stick your fingers in. It's called a diastasis. Do not worry. We're gonna try and avoid it at all costs. And it is fixable, but let's try and avoid it. Okay, it's time now. Now you probably know whether you can go flat on your back. I'm gonna go flat on my back now that I've described when and if you can. Knees are at a 90 degree above your hips, pushing that back into the floor. Heels are hitting the ground. I'm gonna put my head, lie it flat, really feel my lower abs working. Okay, so this brings us to what core exercises should we avoid from the moment we find out we're pregnant? Anything that puts you in a cone position. So right now, I'm just working my lower abs. My torso is not crunching up to meet my lower body. But if it were, it would put me in a cone position like this. So like a V-up, a jackknife, bicycles, anything that puts you in a cone, you want to avoid. And that's it. That's the rule for what core exercises you should avoid while pregnant. All right, remember, side way up. Whew. And then overhead tricep extensions. And if for some reason you are not feeling like this overhead tricep extension is good for you, you can do tricep kickbacks. There we go. But the reality is, the majority of core that you should be doing is just contracting that area about 2 fingers below your belly button. That is the area that you need to work and strengthen for a successful and fast labor and delivery. Okay, one last time. Stationary lunges, right leg, let's go. Down and up. And switch legs. Left leg in front. I'm gonna keep saying it, contract that core. Now let's say you're really enjoying this workout, but you want to take the intensity level up. You feel like you can do it. So the question is, Rebecca, can I still do your other boot camps? Absolutely. But remember all of the rules, all of the guidelines that I'm enforcing here today, and apply them in those workouts. So for example, take more breaks. Make sure that you're not just going from circuit to circuit and not hydrating well. Again, if we're going into a push-up position and you're feeling that tugging, take it to an incline. Okay, side up. Last exercise in circuit 2, overhead tricep extensions. And then we will be done with circuit 2. Eight seconds. 5, 4, 3, 2, and 1. Take a break, get some water, towel off before we move to circuit 3. And how appropriate in circuit 3, we're going to talk about the third trimester. So, we're going to go into sumo squats starting in circuit 3. I'm gonna position you first, then we'll start our timer. Feet are turned out, 9 and 3 o'clock. This should feel great. You can put your weights up here if you're using them. All right, let's get started. Down and up. I mean, this should feel wonderful. This is also a great exercise to really open up the pelvic region. Let that belly hang nice and low. So we'll get through one set, then we'll start talking through some guidelines for the third trimester. Okay, Arnold press-ups. We're gonna take the dumbbells facing you, rotate out, and if you can, press up. If you don't wanna press up, just facing you, rotate out, back in and out. Fifteen seconds. 10 seconds. 5, 4, 3, 2, and 1. Bilateral leg lifts. So we're gonna lie on the ground, and again, you can put 1 or 2 pillows behind you, depending on what you need to elevate yourself. We're gonna take our back, press into the ground, contract our core, and lift and lower both legs. If you're feeling some clicking in your lower back, elevate your head a little bit more, raise your legs a little bit lower, just shorten the distance of lowering and lifting those legs. This is, again, a great lower abdominal exercise to get you ready for labor and delivery. And turn over on your side. Get yourself up. Alternating reverse lunges. So we're going to take our right leg back, then our left, then our right. You've got it. Left. do this one with or without dumbbells. In 10 seconds, we'll start with set 2. And then we'll start talking through the third trimester. Okay. Sumo squats, feet are out at 9 and 3 o'clock, with or without weights, down and up. So the third trimester, you're feeling really good, but you're getting really big. And you're starting to feel a lot of lower abdomen, a little bit of pressure. When you're working out, if you feel any pelvic pressure, you need to stop, elevate your feet, hydrate. Most of the time, this is just a result of a little overexertion, a little dehydration, do not worry. But you always want to check in with your doctor and say, hey, listen, I was working out, I felt a little pelvic pressure, little lower abdomen pressure, what do you think? And depending if they just saw you, what pregnancy this is for you, they might just say, hey, listen, take it easy for an hour, and if the symptoms go away, you should be fine. Or they might say, hey, come on in, let's check you out, but it's probably nothing. Okay, let's go down for those bilateral leg lifts. But the reality is, the more you can work out and stay active during your third trimester, the easier. I'm gonna go flat on my back for this, but again, you should elevate if you need to. Bilateral leg lifts. The faster and easier your labor and delivery will be. So my advice to you is, without pushing yourself beyond your limits, continue to do your boot camps, work out, squats, lunges, lift weights. This is, again, the best way to ensure that you stay strong and injury-free. But you also have to listen to your body. If you've been doing high knees and tuck jumps, and now you feel, when you do it, it feels really uncomfortable because your belly's so big, march in place. I have some women who are jumping hurdles and box jumps and running on the treadmill until the day before they deliver. While I have other women who stop running and jumping somewhere in the second trimester. Okay, we're going to alternate reverse lunges. It all depends. But the third trimester is not the time to just say, well, I'm about to deliver, shouldn't I just sit around? No. In fact, the way to ensure that you stay nice and healthy and dilate at a good pace is to continue to exercise. And there's some secrets too. As you get closer to your due date, squats, lunges, those will help to get you dilated, get things moving. Also eggplant. Okay, let's start our third and final set here, sumo squats. Also make sure in your third trimester, and all along the way, get plenty of omega-3, whether that's from some great salmon, tuna, or if you're taking supplements. That will help you to avoid postpartum depression once you deliver. Here's a little fact. Women who work out continuously throughout their pregnancy have smarter babies. It's a fact, it's in studies. Google it, Arnold press-ups. We have women across the country who do our workouts from the time that they're conceiving until they deliver, and they always receive comments from their OBGYNs that they had the fastest, easiest deliveries. This truly is a great way to prep. Big day. Okay. Going to those bilateral leg lifts. It's our final set of circuit 3. Here we go. So we're gonna finish up circuit 3. We'll get some water. Then we're gonna go to circuit 4 and talk about postpartum. Ten seconds, then we go to alternating reverse lunges. Okay, remember, stand up on your side. Whew. You can tell I'm not pregnant, I just kind of jumped up. So this is the last exercise in circuit 3. And then we have 3 exercises in circuit 4, and we'll dive into postpartum. "15 seconds here. 5, 4, 3, 2, and 1. Done. Get some water. Okay. Whew. We're going to start with lateral raises. So we're going to take our dumbbells, we're actually going to have them facing away from us, our palms away from us. We're going to laterally raise, but with our palms facing away. So we're getting the delts. I'm actually feeling this a little bit in my triceps. Love this exercise. Lighter weights, and if your weights feel like they're too heavy, alternate, just like that. 15 seconds, then we have alternating forward lunges. So as we dive into postpartum, let's talk about weight gain. What's the average amount of weight to gain when you're pregnant? Alternating forward lunges. That's not the answer. There really is no average anymore. It's what does your body need per pregnancy. I know some women who gain 20 pounds, have nice healthy babies, and it's great. I know a lot of women who gain somewhere between 30 to 50, and again, perfectly healthy, they lose the weight. Me personally, I gained between 50 to 70 pounds with each of my 3 pregnancies. I had very healthy babies. I did not have gestational diabetes, but that is in fact what my body needed to do when I was pregnant. It's one of the reasons that I got into fitness, but we can talk about that later. Horizontal chest press. So from your chest, extend out. There is no average weight. Don't worry about the scale. Worry about staying healthy. Worry about the baby inside of you. So now you have the baby. How long will it take to lose the weight? This is what I tell everybody. It took 9 months to lose or to gain it. It will take 9 months to lose it. If you lose it too fast, then what can happen is the elasticity in your skin doesn't have time to rebound, and then you can have some really nice loose skin. So a slow and continual weight loss postpartum is the best way to go. All right, let's pick up the other weight, lateral raises. So you come home from the hospital and you don't know which way is up. Should you start worrying about your workout routine? No. When should you start worrying about your workout routine? Well, first of all, when your doctor gives you the go-ahead to exercise again. The standard for the medical industry is 6 weeks. I've heard of some doctors doing 4 these days, and it depends on, did you have an episiotomy? Did you have a C-section? But let's say the standard's 6 weeks. Trust me, you're gonna be really busy those first 6 weeks. Do not rush it. I hear too many horror stories of women rushing to work out, then getting a postpartum infection in a place you don't wanna think about. And then they're sidelined from exercise for 3 months. Okay, let's go to those alternating forward lunges. So let's just say 6 weeks. And then what do? Start again with this workout. Treat yourself like you're pregnant. Your body has been through a trauma. Do not just go right back to the boot camp. Just because you're not pregnant doesn't mean that your muscles and your ligaments are not ready to do that. Also understand, whether or not you are breastfeeding, your body is producing relaxin. It's a hormone to help produce breast milk. And it makes your ligaments a lot looser, which makes you more prone to injury. So you need to be careful, which is why, again, initially do these postpartum or these prenatal workouts. Okay, horizontal chest press. Now, a lot of you will say, Rebecca, there's no time to work out. I mean, I've got the baby, I'm going back to work. There's just no time. There's time to go back to work. There's time for you to watch your favorite show. If you make time before that day, instead of saying every day, well, I'm gonna work out at 5, and then, honey, can you watch the baby? It's not going to happen. You need to put it in a schedule, like a doctor's appointment. Start off with 4 days a week, and then if you get 3, perfect. But you need to fit into your schedule. Maybe you tell your husband or your significant other, listen, we're gonna have a date night at the gym. We're gonna get a sitter, we're gonna go to the gym, and then we'll grab some dinner. That's one creative way to get in your workouts. But you have to schedule them because otherwise it just won't happen. Lateral raises, that is some of the best advice I can give you. Here's the other. If people say, hey, what can I bring you? Skip the lasagna. Say, hey, listen, it would be really helpful, like, if you can make me, a tray of chicken or a tray of salad. So that way they've set up meal prepping for you. I'm not saying you can't have carbs postpartum, but if you want to start shedding some of those pounds right away, the best way to do is get a good amount of protein and some good fibrous vegetables in the mix. And then you can have some pasta, you can have some rice, but in moderation. Okay, but if you let people just make you whatever, trust me, everybody's gonna bring you a lasagna. Alternating forward lunges. And then something else, if people bring you a lot of food and you can't eat it all right away, cut it up in portions, put it in your freezer. Now you have your meal prepping for later on down the road. Maybe look up some healthy recipes that you like and just give people some ideas. People will ask you, hey, what can I do for you? It'd be great. I know you make a great turkey chili. If you can make me some of that, we could really use that. Okay, chest press. This is the end of circuit 4, the end of the workout, and then we'll do a quick stretch. This is it. 20 seconds here. Ten seconds. And workout is complete. Get some water, towel off, and we'll do a quick stretch. So we're gonna get down on the ground, seated position. Let's take our left leg, cross it over if you can, your right, and twist your body slightly. Get a nice lower body stretch. You might, depending on where you're at your pregnancy, you might not be able to get your leg over that much. Just whatever you can. You just wanna get a nice lower back stretch right here. We'll also take this to the floor momentarily. So if you're struggling because your belly's too big, no worries. Now let's switch it. My right leg is over my left, and I'm taking my left elbow over to the right side. And again, you feel this in your lower back and your hips. Wonderful. Okay, now's a good time. If you need those pillows, put them on the ground. We're gonna take our right leg, put it over our left. You want to face the same way as me because I'm going to be, instead of mirroring you, I just want you to face the same way. And we're going to take our right over to the right side, and then as much as we can, our left knee over to the left side. So we're loosening up our hips, and again, elevate your head if you can't lie flat. Loosening up those hips. This loosens up the hips, stretches out the lower back. I love this. This is like a figure 4 sweep. Okay, now let's take the left leg over the right and we sweep side to side. My left knee touches the ground, now my right knee. Oh, this feels great. So I'm gonna put my hands behind my head. Beautiful. With your legs up, or with your head elevated if you need to, otherwise flat on the back, take your right leg and just place your hands behind your knee, and we're gonna get a nice hamstring stretch. Hold it here, flex the feet as much as possible. You can walk it up. As you walk it up, you'll get a more of a calf stretch, which is great, especially if you're somebody who gets those Charlie horses in the middle of the night. Okay, let's switch. Hamstring, left hamstring. Walk it up to the calves. Nice job. Okay. We're going onto our side. We're gonna stand up now. We're gonna take our elbows inside of our knees and just shift our hips side to side. While you are holding on to something, we're gonna do a quad stretch. So hold on to a pole, a fixed object, and if you don't feel comfortable, don't do this exercise because you are on one foot. We're gonna get a quad stretch. Switch. Now, put your toe up, either against your stepper or against the wall. Heel on the floor. Push into it. It's another great calf stretch. Do these also before you go to bed at night, and again, that will help to avoid those Charlie horses in the middle of the night. I know a lot of you out there know exactly what I'm talking about, and if you don't, do these and you can avoid them. Switch feet. All right, let's get some upper body. Take your right arm in front. Bring your elbow. Cross to your left shoulder. Feel this in your delts. Switch arms. Now take your right elbow, have your right hand touching your left shoulder, and switch. All right, let's get our lats. Grab your right wrist, bring it over to the left side. You're gonna feel this along the length of your back. And switch. Kick our neck lightly, side, and breathe in, breathe out, breathe in, breathe out, and you are done. Stop right there. What do you think you're doing? Stay tuned for our next video and click right here to subscribe to our YouTube channel. Follow us on Facebook, Instagram, and TikTok.